You're listening to the Jackson House Podcast, the starting point of your journey to recovery. Whether it's you or a loved one navigating mental health challenges or addiction, we're here to offer support. Get to know the dedicated professionals guiding you, hear powerful stories of transformation, and discover valuable tools and tips to maintain your well-being and sustain recovery. Welcome to your supportive community at both West Coast Recovery Centers and Jackson House.
Well, welcome back to another episode of the Jackson House Podcast. I'm here today at our treatment center located in Temecula, California. Mental health concerns and substance abuse are on a rapid incline. This makes an urgent need for effective care and support systems that are accessible to people when they need them most. The World Health Organization noted that in 2023, depression and anxiety are at the top of the mental health conditions. And with these numbers on the rise, our guest today can offer encouragement on the process of starting therapy here at Jackson House, making it a little less daunting for someone on the fence about reaching out. So with me today is Ulla Anderson. She's one of the amazing and knowledgeable counselors that you will find here at our Temecula Riverside location. So welcome, Ulla, and thank you for your time today and meeting with me.
Thank you. My pleasure.
So why don't we start with just, tell us a little bit about your role here at Jackson House, what got you interested in the counseling field and maybe specifically mental health?
So I am a counselor here, and my primary role is to conduct individual sessions with our clients here. And I also do quite a few group therapy sessions. We help our clients too with family-oriented sessions, contact family with updates and things like that. One of my favorite groups that I do is an art therapy group. That's on every Sunday.
I'm sure the clients enjoy that too. It kind of mixes up the daily routine somewhat. So what do you enjoy most about your job here at Jackson House?
I think what I enjoy the most is really helping our clients to see themselves in a different way. Mm-hmm. The majority of the clients that we have here have had severe trauma histories. And because of that, a lot of them struggle with self-esteem problems, like thinking of themselves as not perhaps being worthy and not being good enough. So my favorite thing is helping people maybe begin to sort of change their minds a little bit about how they think of themselves.
Yeah, and probably nice to see when they make that shift within themselves, where that takes them on their next journey. So what about, I know you had mentioned before that you've worked in a hospital setting. Mm-hmm. So what would you say is different about working in a residential treatment facility versus that of a hospital?
Well, a hospital setting is much more acute. Mm-hmm. And in the position I was in, I did have contact with our patients, but not in the same way as we do here. It's more of an intimate setting, being in a residential setting, smaller groups of staff, and you get to know the clients on a whole different level, spending like 8 hours a day interacting with our clients, having sessions with the clients. You really sort of dive into their lives, and that's something I really enjoy.
Yeah. So it sounds like it's not just, they're coming here and getting help from professionals, but they're also getting this intimate setting where they get to know peers and other people with similar situations in their lives, and it really makes them feel that they're not alone.
Agree.
Yeah. So what would you say that clients have shared with you about their experience here and what they found valuable?
I think the primary thing that I always hear is that staff has been really supportive. Staff is always there to listen to them and help them in any way. Yeah. And in addition to that, I also know that I sometimes call clients and check up on them after they have discharged, and they're really appreciative of that we still care about them after they leave. And we have our alumni support meeting every week too, that clients, if they choose to do so, they can continue to get sort of like aftercare through Jackson House and stay in touch with each other and just get that support both from clients that are here currently as well as from others that have already, moved on to their lives.
So, it's like they have a connection to people who are a testimony of what they can be. Somebody might be a few steps further down the road than them, and so it gives them hope to keep moving forward. I would assume. In fact, I know you shared with me a Google review that somebody had written, and
Welcome to share.
yeah, I just want to say that one line about it was this you carry your. This is your little Bible here, why you do what you do. But yeah, that part where they said to love yourself again.
Okay, so it says, "Thank you, Jackson House Temecula. This place helped me learn to love myself again." And I can't think of anything that's more important than that. So just to reiterate again, I think that, I don't know percentage-wise, but I'm thinking at least 95% of the clients we have not so positive thoughts about themselves, self-esteem. So that someone actually says when they left that we help them love themselves again. I can't think of anything that's more important than that.
Yeah.
Because everything comes from that, and how you then interact in your life and your social life, and how you feel and how you treat yourself. Because if you dislike yourself, you're also not going to treat yourself, in a dignified way. And then you're also more likely to even attract, other people that in your life that mistreat you as well.
Absolutely. So it's a great point.
Yeah.
What advice would you have to somebody who is seeking help for the first time and maybe on the fence about making that call?
Well, there's several things I could think of. If it was me, I would probably do a little bit of research online, like Google research, and look at different places, see if they meet your needs, or you think that they meet your needs, and also maybe look at the reviews. Yeah. And then at the same time, maybe just call around and ask, can you give us a little information about the program? But I also think that in general, most people are probably going to feel anxious about seeking help, and that's understandable, because you're walking out of your comfort zone, and you're going to say, I'm going to admit myself to a program where I'm going to stay for a while. And that in itself is anxiety provoking, but that's normal too, to feel anxious about that. But I would say on an overall that if you need help, just know that you're worth it.
Yeah. I love that. I love that. So I think you just brought up a really good point that when people walk in, that can provoke some anxiety as well. And you've seen people walk through the door here for their first time. Mm-hmm. So day one for the time that they leave, what transition do you see in people typically from where they start to where they finish when they walk through the treatment here?
Well, many of them come and tell you after a week or two, that there's a huge difference. I remember one client in particular with really, really severe depression and OCD. And I remember in the beginning of the program, she couldn't even look at you. She would have no eye contact, and she couldn't sit with her hands in her lap and just be relaxed because she felt contaminated. Right. So I remember 2 weeks later, she was able to sit with her hands in her lap and look at you. And I asked her, I said, I noticed that you have your hands in your lap. And she said, yes, she goes, I still feel contaminated, but I'm okay with it. That was amazing. So sometimes you see those really, really huge changes in people, and they're able to go back to their lives again. I don't know that we can cure people within a couple of weeks in a short-term residential or 20 days. But you can put somebody on a course, right?
Where the start of
the start of something, and then continue to do what they have learned when they leave.
Right. So you bring up a good point with that. Long-term care. This isn't just a 3-4 week thing and then you're done. This is a continuous level of care and a continuous journey for people to walk on. So what would you say is most important when they leave Jackson House for somebody to be successful in their road to recovery?
There's many factors involved in that. So we have a transition specialist that sets our clients up with aftercare plans, whether that's going to an outpatient programs or they're going to see their own psychiatrist, therapist, whatever it is that's appropriate for each client. But so it's also to keep on practicing the things that you've learned. And we have, lots and lots of handouts and worksheets, and lots of clients talk about how they continue to use the different skills when they leave here. But also another important thing I can think of is that to be aware of if and when you might be relapsing back into disease. What are those early signs so that you can ask for help before it gets to the point where maybe you need psychiatric hospitalization.
Right.
To avoid that if possible, and practice those coping skills.
Right.
So.
Well, because I think that's a great point, and that might be a question that doesn't get talked about as often as it should, because when a person gets back to their everyday routine in life, what happens when an unexpected event triggers them and it threatens to derail the hard work that they've already put into things and the progress that they've made? So how would you say one could learn to balance the reality of being vulnerable and also being resilient at the same time?
Yeah, that is a good question, and I think that's something that all of us have to encounter in our lives. I think that one of the things that we do is try and help our clients build emotional resiliency. But sometimes even with that, things happen that, like you said, that really completely derails you. I remember one client that was here, her dad died while she was here, and that's clearly a huge stressor.
Yeah.
But so to have that strong support in place, have someone to talk to, and know also that it's okay sometimes to not feel good, actually, and just walk into it, walk into the fear and feel it, but talk about it and process it. And
yeah,
it's part of life to sometimes not feel so good.
Absolutely.
But it's temporary.
Absolutely.
But some stresses are clearly more difficult to deal with than others.
Yeah.
So.
And I can just tell, I know the staff loves you, clients love you. You have a very genuine approach about yourself. And I would imagine that carries through when you're interacting with your clients and they feel your sincere desire to help them and also relate to them, that says life isn't going to be perfect all the time. We're going to have these moments, and we can learn the skills that we've learned here to really, pull us through.
Thank you.
Yeah. What would you say is your approach when you're working with clients that sets you apart?
That sets me apart. I have a good sense of humor.
Oh, I love that.
I may not come out so much right now, but I do. But no, I think I just try and meet people where they're at, not be judgmental, and just kind of like, a big thing is always helping clients to be relaxed.
Yeah.
Before you even, go into any kind of therapy, but just meet them where they're at and be open, non-judgmental, and figure out what is it that they want to accomplish. But also, I think in every situation when I'm with somebody, you assess them all the time. What seems to be what is it that's holding them back? For example, I'm going back to again, because that's my big thing, is what do they think of themselves? And then sometimes educate a little bit about where do you think that came from, that you think that you're worthless.
Yeah.
And that often comes from, years of experience with other people putting you down and putting thoughts and ideas into your head. So cognitive behavior therapy is my big thing in trying to dissect that and where does it come from, and realize that just because somebody else said that you're worthless, it doesn't mean that you are. That was just their opinion,
right,
and a reflection of them.
Exactly.
To keep saying that over and over again in many different ways.
Yeah.
So I do that a lot.
Well, I know that anybody coming here is lucky to have you.
Yeah.
Thank you. Well, yeah, thank you. And thank you for your time and sharing a little bit about Jackson House Temecula. Remember, taking the first step towards recovery might feel a little scary, but it's actually a step towards hope and a brighter future. So if you or someone you know is struggling with mental health or addiction challenges, reach out to us at Jackson House. You will be supported and surrounded by a knowledgeable team who truly cares about your success and well-being. One call can change a life. And if our discussion moved you today, please share, follow, and rate this podcast. Your support will help us reach others who may need to hear that they are not alone. Together, we will make a difference. One story, one call, one life at a time. Thanks for joining us today.
Thank you for joining us on today's episode. We hope you've gained valuable insights and feel more empowered in your journey. If you or a loved one is facing mental health challenges or addiction, remember, you're not alone. Jackson House can help. Hold on to hope and take the first step towards transformation. Give us a call at 888-255-9280. Your path to recovery starts now.